Hi, my name is Brian Jones, and today I'm going to be going over a potential lesson plan and teaching segment that is intended for college sophomores who are entering nursing school. And this particular lecture is going to be going over the disease process of asthma and also primarily what medications are best used to help control this disease and how these nurses or future nurses could potentially help their patients with these medications. So by the end of this lesson, the students will better understand the disease along with the medications that are used. The objectives, students should be able to describe the signs and symptoms, comorbidities, and risk factors for asthma. They should also be able to explain the most common drugs to treat asthma and exactly how they work. And also, they should be able to determine the best pharmaceutical approach to helping their patients with asthma and how to best select those pharmaceutical interventions. So to begin with, we're going to talk about the disease of asthma. And why do we talk about it? Yes, this is more like good to know information, but it is my personal belief that the best way to fight something is to know exactly what you're fighting. So we're going to talk about it to begin with. Prevalence of asthma is actually very high. In the United States, it's 8.4% of all people, with 9.5% of those being in the youth population, so children. Prevalence is also actually higher in populations with a lower socioeconomic status. Some of the signs and symptoms of asthma include a cough, chest tightness, and expiratory wheeze, and then continuous shortness of breath. In addition to this, some of the contributing factors that lead to asthma include rhinitis, sinusitis, GERD, obstructive sleep apnea, and then certain hormonal disorders as well. Some of the comorbidities include decreased lung capacity, an increased risk of pneumonia, and then in some cases even leading or contributing to COPD. The risk factors include age, being where children are at a higher risk. Certain genetic factors do contribute. We have environmental factors, which we're going to discuss a little bit more, and then we've already mentioned the socioeconomic status. Now, although there's no exact test there's no gold standard in testing, there are some common tests, lung spirometry, and then also methacholine or mannitol challenges to see exactly how well the lungs are functioning and determine the amount of constriction. Now, the things that you really need to know start off with what is the most common medication for treating asthma. Almost all patients with asthma actually are prescribed some form of a beta adrenergic agonist, okay? Also referred to as SABAs, short-acting beta agonist, and LABAs, long-acting beta agonists. Now, the short-acting and long-acting both work as bronchodilators, which work by relaxing the smooth muscle of the airways and provide that, a relief. Especially the short-acting ones have an onset of 5 to 30 minutes and can provide relief for up to 4 to 6 hours. They're what's used in the acute phase of the onset of symptoms and for the immediate relief of symptoms. A lot of people refer to these as rescue inhalers, especially with the short-acting medications, and these include albuterol and levobuterol. But they can also be a monotherapy. It's not usually used as a monotherapy, but can be used as a monotherapy for certain patients, and those are patients with only intermittent symptoms of asthma and also with exercise-induced asthma, which is exactly what it sounds like. It only comes on after intense bouts of exercise. In addition to the short actings, we also have the long acting beta agonists, and these have a longer onset action but also have a longer duration of action, up to 12 hours and sometimes even longer. Most common of these is salmeterol, and they work also by acting as bronchodilators, but they also work by blocking the muscarinic receptors within the muscles surrounding the airways and keeping them from constricting and constricting the airways overall. Now, because these are administered inhaled and through the respiratory system rather than systemically, the primary side effect or adverse side effect that you have to worry about is going to be tachycardia. That's going to happen in almost every patient. However, if these same medications were to be given in a systemic fashion, you would also need to worry about hyperglycemia, hypokalemia, and hypomagnesemia. But because they are inhaled, we don't have to worry about these as much. Also, medications that are used in the, or some other medications rather, that are used in the acute phase management are going to be oral and IV corticosteroids. These corticosteroids are only going to be used in extreme cases where patients are experiencing very significant difficulty breathing, but the short-acting inhalers, such as the albuterol, are not effective. They do work by decreasing the inflammation in the airways, as all steroids do. However, the only side effect, these have several side effects actually, and they cannot be used long term because of these significant side effects, which can lead to several different adverse conditions in the body if they're used long term. Now, in addition to the acute phase management, one of the things that a person with asthma has to consider is that they're going to have an ongoing continuous management, which includes a regimen of medications. And some of these medications include inhaled corticosteroids. So rather than the oral and IV version, these are going to be inhaled. They have much fewer systemic side effects because they are inhaled, and they actually are the preferred therapy for long-term control of the disease. And these actually work by, again, reducing the swelling within the airways, and they're very effective for that long-term use. And probably the most common of these medications is going to be budesonide. And these are actually, you're going to find these in modern medications in combination with several of the long-acting beta agonist medications. And the two together work very well for more of an acute phase management along with long-term prevention of the asthma symptoms. Now, in addition to these ongoing management medications, we also have what are called leukotriene modifiers, and these work by blocking the actions of the leukotrienes within the system, which thereby they prevent excess mucus and secretions from building up in the airways, along with tightening of the muscles that surround the airways. And the most common of these is montelukast or Singulair. Now, in certain cases, medications are not going to work for some patients. And for these patients where medications have proven ineffective, or you may even have patients where medications are not an option for whatever reason with their body chemistry or with certain ability to take medications. And if this is determined to be the case, a highly uncommon approach to the therapy is going to be, there's actually one FDA-approved surgical treatment for asthma, and it's called bronchial thermoplasty. And this is actually when an electrode is passed into the airway, and it's used to actually destroy and remove the amount of muscle that is available to constrict around the airways. But as you can imagine, that is not a preferred treatment because of the need for the musculature around in the airways to help them operate properly. But in some patients, when that's the only thing that works, then that's what we need to use. Now, one of the things that is most important for the nurse to remember about helping a patient with asthma is helping to learn how to live with the disease. And this includes education, as often as our profession is called upon to do. So the biggest thing that you can help educate your patient is to make sure that they, number one, identify their triggers. So all patients are going to have some sort of a trigger to their asthma symptoms. So whether that trigger includes something that's environmental, some sort of smoke or chemical, or it's exercise induced like we discussed earlier, whatever the trigger may be, they need to obviously avoid those triggers. But in addition to that, they need to work very closely and very honestly with their medical team to help try to find the right medications that will be effective in treating their asthma, both short-term symptoms and long-term management, and to make sure that they take those medications and utilize those therapies on a regular basis to prevent any of the ongoing symptoms and problems that come along with the disease. And you may be asking yourself, well, how do I determine what medications are best for my patient? Well, the answer to that question is going to be just make sure that you come into it with an individual approach, and you don't try to categorize certain people, with all exercise-induced people are going to respond to this medication or whatever the case might be. But an individualized approach, and realize that it's more of a trial and error process to find the right medications and the right therapies that are going to work to help to manage their symptoms, both short and long term. So that's all I have for today. Does anyone have any questions? All right, well, thank you very much for your time.